Now let's go to diagnosis according to Jinya imbalances. Let's talk about phlegm. Phlegm is a very comprehensive concept in Chinese medicine. Phlegm is both an etiological factor and a pathological condition. Phlegm can be difficult for novices to diagnose. This is because the symptoms and signs are often not as tangible as they are in other patterns. Phlegm signs can be as varied as they are subtle. Phlegm is often involved in or is directly responsible for many complex and chronic conditions. In Chinese medicine, there are two relevant aphorisms. Phlegm is the root of the 100 disorders, and all the strange symptoms and diseases are caused by phlegm. The signs and symptoms of phlegm can be difficult to recognize in the beginning because they are so subtle and varied. Textbooks that are published in China and those that are inspired by these textbooks tend to describe only a few gross phlegm symptoms and signs. But phlegm is not usually as obvious as this. Phlegm is something you have to train yourself to see. It is often difficult to define precisely. Why there is a diagnosis of phlegm. It is usually the sum of many small, subtle signs. Phlegm is fluids that have congealed, coagulated, or thickened because these body fluids have changed their form or structure. They have none of the nourishing or moisturizing qualities that Jinya has. They have thus gone from being an aspect of Zhang Qi to becoming a form of pathogenic Qi. Phlegm can be substantial, that is, it can be seen, or insubstantial, that is, it is not visible to the naked eye. Substantial phlegm can be observed as sputum and mucus in the respiratory passages, stool, or menstrual blood. Non-substantial phlegm can be observed or palpated below the surface of the skin as nodules, ganglion cysts, deformations of bones and cartilage, uterine fibroids, lumps, and other physical accumulations in the tissues, such as gallstones and kidney stones. Non-substantial phlegm also manifests as a sensation of heaviness in the body and the head, numbness, fatigue, mental confusion, depression, dizziness, nausea, and chest oppression. The pulse can be slippery or wiry, and the tongue can be swollen and have a greasy coating. Phlegm is a heavy and sticky yin pathogen. It shares characteristics with dampness, but phlegm is stickier and even more disruptive of the body's qi ji, because both phlegm and dampness block the kuli. This has important consequences. First, it will result in the blockage of qi, blood, and jinie. This means that there may be signs of stagnation of these substances in general and of the various qi ji around the body. This could be symptoms and signs such as nausea, loss of appetite, and heaviness in the chest, as if there's a large stone on top of the chest. Phlegm's blockage of qi in the upper jiao can also result in palpitations and a shortness of breath. The stagnation of qi can cause a person to feel fatigued and lack energy. The feeling of fatigue will be worse in the morning because the lack of movement of qi during the night will increase the stagnation of phlegm. They will often feel very tired in the mornings and can have difficulty waking up. The fatigue and heaviness can also result in an increased need for sleep. The problem is that the person will often find that the more they sleep, the more tired and heavy they feel. This is because phlegm will stagnate even more whilst they are lying down. As well as fatigue, they may feel that they are a bit fuzzy and heavy-headed and are not fully present mentally. This will be especially apparent in the mornings, when they will often not be fully present and will go around in a bubble. They may also lack appetite in the morning, and if they have a cough, it will be worse in the mornings. Once they get going and are physically active, the signs and symptoms will improve. Phlegm can also manifest with areas of skin that are numb, because phlegm will block blood and thereby shen, so that it does not circulate in the area. This is also why phlegm can result in numbness elsewhere in the body. As well as stagnation, the body can be characterized by heaviness. This will also be seen on the mental and emotional level because phlegm will block the heart's orifices. This means that Shen is restricted in its movement, which is why phlegm can often be a contributing factor when a person suffers from depression. When phlegm is very pronounced, it can be seen in the person's eyes. There can be a tendency to have blobs of sleep in the eyes, and eyes can seem glazed. The Shen in their eyes is not bright and lucid. It can be difficult to make clear eye contact. They may look into space whilst they are talking to you, and not because they are shy and have difficulty looking you directly in the eye, as is the case when there is heart and gallbladder qi deficiency, or because their gaze is restless and shifting, as it is when there is heart fire or phlegm fire. Rather, it is because their shen is smothered and blocked, and they are in the bubble of their own. Their gaze does not come out of their head. These eyes and their vision can be observed when someone has drunk excessive alcohol or taken narcotics. They may also have the feeling that they are in a bell jar. It's a feeling most people have experienced when they have had a heavy cold because Shen is blocked, and the person may seem confused and unclear in their thinking. They may have difficulty finding words. If the blockage is severe, they will have incoherent speech or think one thing but say something else. In extreme cases, for example, in some mental illnesses, a person can sit and talk to themselves or to a person who is not there. Thank you for your attention.